Hey everyone, it's Val, Team RNY. Um, I am coming to you today after my pre-op appointment with my new surgeon. So in my last video I was talking a little bit about how my previous surgeon that I so carefully selected for myself left the network that my insurance covers. So I was kind of just thrown over to one of his colleagues within the same program that I was already in. And I met with him today, which is kind of funny because it was my pre-op appointment and also the first time meeting my surgeon. So it turned out really, really well though, because he is awesome. I was really excited. He is a little bit more approachable and conversational. Like with a lot of surgeons, the previous surgeon that I had, Dr. Gagne, was a little bit arrogant and direct. That certainly doesn't speak to him as a surgeon or a person. It's just his bedside manner. But Dr. Brendan Marr is my new surgeon with the Allegheny Health Network Bariatric Metabolic Institute. And yeah, like I said, I really, really like him. He right away was like, "Oh, you're one of Dr. Gagne's refugees." And I was like, yes, I am. And he went right into like an apology on like the whole situation and said that he was happy to take care of me if I felt comfortable with him, which I thought was really nice. Class act. So he kind of went over everything with me as though it was our like first meeting, as if I was a new bariatric patient, and explained the whole anatomy of a gastric bypass and what it entails, and just covered all the bases, which was really, really nice. He also left a lot of room for questions, or not left a lot of room, but asked multiple times if I had a lot of questions, which was nice because it kind of left me time to develop some questions and get some things answered. I really, really liked him, and I just feel like maybe this all happened for a reason. So, another thing I wanted to mention before I start my video. I'm at my mom's house, and her dog goes on crazy barking fits sometimes. So, if you hear barking, apologies. So after meeting with the new surgeon, I met with his PA, and she was also really great. I'm really excited about my new team. So the first thing she did was she gave me this surgical scrub, and it was just provided by them, and the instructions on it are just to wash my entire belly area the night before the surgery and the morning before the surgery. So it's an antimicrobial, so just to sterilize everything and avoid infection. Then she gave me these nice little pre-op instructions. And the very first thing on it is exactly what I was talking about in my last video. It says, diet. Do not eat as if this will be your last meal. Whoops. I am still struggling with this. Yeah, I mean, I know that I'm still supposed to be doing the damn diet, but I'm having trouble. And we did discuss it, and it's just what it is. I can't be doing that. So the other thing, this is a good note for anybody else who's pre-op or just starting the process or anything like that. I had to have blood work done again today, which I had it done toward the beginning of the 6 months, and that was stupid because I needed to have it done within 90 days of the surgery date. So I didn't know that. So I just had to have blood work done again today. This will be nice to be gone. So I had my blood work done, and then it does say that it needs to be done. That's a tricky situation because they want it done within 90 days, but 3 weeks before surgery. So good thing I had it done today because I'm already 2.5 weeks out. So the next thing on my list here is to stock up on Crystal Light, broth, Gatorade, popsicles, sugar-free popsicles, and just kind of prepare for the liquid diet that I'll be on. 1 week out from surgery, stop any blood thinners like aspirin, ibuprofen, any NSAIDs. I'm not on blood thinners, and I very rarely take any sort of pain medication for, I don't know, whatever. So that's like whatever. The day before surgery is going to be clear liquids only. It does say to make sure that you drink plenty to avoid dehydration. But yeah, I'll dive more into the diet portion of things because I did meet with a dietitian again and we went into detail about it. And then the business day before my surgery, so one business day before, which for me will be Black Friday, is when they'll call and let me know what time I have to come. And then nothing to eat or drink midnight before the surgery. Let's see. Day of surgery. I really like this because it kind of lays out what everything's going to look like for you, so you can plan for it and you can just be on track. So I'll see the surgeon and the anesthesiologist. I'll have an IV placed. I'll be taken back for surgery. They'll do the surgery. Dr. Marr said that it takes about an hour and a half. And then he also does an endoscopy after the surgery to check for leaks and bleeding. Because he feels that since we're right there in the OR already, he can check inside and see if everything's going okay. I guess they'll pump me full of air to kind of test out the leaks and the bleeding thing. And then if there's any problems, they right away just nip it in the bud and fix it. I'm assuming that pumping me full of air is going to be painful afterward with like gas, and that'll be fun to deal with. More on that later. And then after surgery, I'll be in a recovery room and then to a room on a post-op surgical floor. When I wake up, I'll still have the IV. I'll still have a catheter in. They did say that the catheter gets removed the morning after surgery. I assume it might be a little bit difficult to get up and move around, and they're not really sure about like what my abilities will be at that point, so that's why they keep it in. And then it does say if you're able and you feel up to it, they encourage you to get up and walk around the floor the evening of surgery. So day after, I'll start doing clear liquids. I'll walk around the hospital at least 3 to 4 times a day. Some people do get discharged the day after. However, my doctor did say that I will be there for 2 nights. I don't know if that was just like, some people stay 2 nights, or if he's just like, no, all my patients stay 2 nights. I'm planning for 2 nights, so whatever. It says day 2 after surgery, you will be discharged. Somebody will have to drive you home because you'll be on pain medication, and they load you up before you go so that you kind of have a nice, easier transition. Then it says, first 2 weeks after surgery, 2 rules: drink and walk. So the goal is 60 to 84 ounces of fluid each day. The idea behind this is that there's, when your body is burning fat, ketones are produced as a byproduct, and drinking the water helps flush those ketones out. The ketones are what's going to make you feel tired and nauseated, and the more you drink, the more you flush those out, the more that you will not be tired and nauseated. So that's a really good note, and I'm really glad that they explained that to me because I was a little bit concerned. I mean, nobody likes feeling sick, but I have a strong aversion to feeling sick. So I I mean, it's probably one of my biggest concerns within the surgery is like, I don't want to feel like I'm going to throw up, because that's like my worst nightmare. But I know it's going to happen. I know that I'll probably be a little bit nauseated. Fingers crossed that it doesn't go too terribly, but flushing those out of your system is the most important. So that's why they want you to constantly take small sips to get as much fluid in as you can. And they do want you to keep track of how much you're drinking. So they say regular Gatorade can also help you feel better. I know that my previous surgeon said that he encourages his patients to drink Gatorade like all the time right after surgery. So that's good. And then walking. You need to get up and walk for a few minutes every hour so that you don't develop blood clots. Pretty standard there when it comes to surgery. So that was that portion of things. And then I also met with a dietitian today, like I said, and we went over the pre-op diet. So I will be on 1 week of a liquid diet. So 7 days before the procedure, the idea behind it, I thought this was really interesting because I guess I had no idea the reasoning behind the liquid diet. Like, I was like, oh, it makes sense. You don't want anything in your stomach when they're going to be cutting it apart and blah, blah, blah. But the purpose of the liquid diet is to shrink the size of your liver and deplete your glycogen stores, which make laparoscopic surgery placement easier. Had no idea. So there are 3 categories of foods that I can have in this pre-op diet, and each category has a different amount that you're allowed to eat. So the first group is proteins, and I can have 3 servings of proteins a day. So first thing, protein powder. My team wants me to have protein isolate in the ingredients in the protein shakes. A lot of protein shakes, I lost the word. A lot of protein shakes are made with protein from concentrate. So like Premier Protein is made from protein concentrate. I'm having trouble speaking now. But I have to have protein isolate. So I need to find a good form of this protein isolate. And then they want me to mix it with skim milk. They said skim milk is preferred, but I can mix it with water if I prefer. And the other 2 protein sources I'm allowed to have are sugar. Nope. What? No sugar added. Carnation instant breakfast. Don't have sugar. Don't do it. And then 8 ounces of low sodium condensed soup made with skim or 1% milk. So I'm excited about that because I will be on this diet on Thanksgiving. So I will be able to sit down at the table with my family and have 8 ounces of delicious cream of chicken soup. Woohoo! Okay, so that's the first category. Second category, I can have no more than 6 servings of the following a day. A half a cup of cottage cheese, the 1% cottage cheese. One reduced fat string cheese, a light yogurt, a half a cup of plain instant cream of wheat that you can spice up however you like as long as it's not sugar, a half a cup of sugar-free pudding, or a half a cup of unsweetened applesauce. So that's good. And then the next category is clear liquids, and you can have unlimited amounts of clear liquids because it does not contain any excess sugar or fat. So broth of all varieties, sugar-free popsicles or Jell-O, all non-carbonated sugar-free beverages. So like 0-calorie vitamin water, Sobe 0-calorie, Crystal Light, all of those good things. And then it does say caffeine-free tea or coffee. However, the dietitian let me know that I'm allowed to have 16 ounces of caffeine a day. So if I tend to get a caffeine headache, I can have up to 16 ounces a day. So that's great. And then just the day before surgery, I have to do clear liquids only. So that was really good. I'm excited. I am ready, like, just to get it over with. I think that the biggest thing that I want to do now, and the other night I actually did not end up checking out vitamins, so I'm glad, because I got more clear instructions on what I need to have. So I currently take gummy vitamins, and they told me not to take those because they don't absorb as well. What I need to get are the chewables. And they told me for my multivitamin to get a senior multivitamin, like Centrum Silver or something similar, because they have a higher potency of the vitamins. So that was interesting. So I'm going to look for that. And then because I am having the gastric bypass specifically, I have to have calcium citrate only. It does say here in this booklet that I'm reading out of that calcium carbonate can be used for the sleeve gastrectomy and the adjustable gastric band. But I don't know, I'm special. So, and then chewable vitamin D3. That'll be cool to find. And B12, which is fine. I already have sublingual B12. It's the kind that you put under your tongue and it melts away and it tastes like cherries. So, that's about it for the vitamins. It does say that some people will require iron and vitamin C and zinc. I don't know. I guess they'll determine that later if I need those. Probably will depend on the results of my labs after surgery. So I'm getting really excited. I am sort of preparing for recovery and what it's going to look like, and trying to decide whether or not I'm going to stay at my mom's house or whether or not I'm going to go to my house. Might be easier to be at my mom's house, honestly, because I don't know, it's home, you know, like everything's on one floor. Not like my bedroom at my house is on one floor as well, or on the same floor as the bathroom and everything, but it might just be easier. My cousin and I were actually talking about getting a mini fridge that we have and hooking it up to just keep in like the food for my diet, so that I don't have to go to the main fridge and open it up and see like all of the other foods that I can't have, which might be a really good idea for the beginning. I know that obviously I will need to like get used to eating things differently, but it might be nice to just kind of like have one place that's fully stocked, that things don't get like pushed around and I can just go to grab whatever I need. So I thought that was a really good idea. I was also looking, if anybody who has had any sort of bariatric surgery in the past has gotten any of these things, let me know what you think. So my cousin was doing some research and telling me, or like showed me this cool article that was like X amount of things that I wanted for my bariatric surgery recovery. And they had, what do you call it? Like an abdominal band on it to like, you know, wear around your stomach, because they said that people feel after a bariatric surgery like their stomach is displaced, or like, I don't know. Has anybody used those or felt like it would have been, I don't know, comforting or helpful? Let me know what you think. I am looking forward to the next couple of weeks. I bet there will be more updates as I prepare and get more things. So I am looking forward to updating you guys soon, and I will see ya.